Have you heard what Dr. Oz thinks about probiotics? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got the beautiful Tina Nunziato sitting right here by my side. Hopefully you're watching us on YouTube, but if not, you're listening to us, and we just want to welcome you. We want to thank you for being on this journey with us. If you are a first-time listener, welcome. Please check out our library. We've got 500?
Almost
500 podcasts out there. And if you're one of our regular listeners, we love and appreciate that you continue with us on this journey. So let's talk about probiotics, or let's talk about what Dr. Oz thinks about probiotics. Very cool article that you sent to me. Thank you.
I actually, it got triggered to me because I've been reading, obviously keeping up on what's going on with the politics. And so I'm getting a lot of those political articles. And I had gotten the one the end of March about Dr. Oz going before the Senate to get approved to basically oversee Medicare, Medicaid, Obamacare. I mean, that's a pretty big deal.
Huge responsibility.
And then Dr. Oz is the guy. So I was like, wow, like this is just,
it's amazing his career. What he's done throughout the years. I mean, I think probably all of you or most of you are most familiar with him from the Dr. Oz show. That actually I think was born from him being found by Oprah, right?
That's correct, yes.
Yeah. He is a cardiovascular surgeon. Yes. And guess he was born here in the States, but his father immigrated from Turkey, and he was also a cardiovascular surgeon?
He was a heart surgeon.
Okay,
yes.
Cool, very cool.
Cardio doctor. So yeah, he's born in Cleveland, Ohio. Got found by Oprah 2009, started the Dr. Oz show.
That's cool.
Ran for 13 seasons.
That's
Apparently,
amazing.
Yeah, during that time he was also still practicing medicine. I guess he didn't stop doing his surgeries until 2018.
Okay, the show came on in 2009. Wow.
Yeah,
so
for 13 seasons.
For all those years.
Yeah, he was doing that. And the show was primarily him giving advice to people about health and different medicines and different maybe new procedures that were out, so he's basically educating people. But then also he, had companies that he was promoting and that he backed. And I guess some of those companies were like multi-level marketing companies, and he was under scrutiny for a while, actually, with regard to that. There was a lot of legal stuff that happened because of his involvement with some of these companies that he was promoting. So, he's been through a lot. He on Trump's last term, he appointed him to run the President's Council on Sports and Nutrition. And I didn't hear much about that back then.
I mean, maybe
I heard it,
that.
but it's like, okay, well, what is that? And
Right.
So, but yeah, now with this big, back in March when he was going through the process with the Senate to be confirmed, he actually officially got confirmed by the Senate on April 3rd. So he is officially overseeing, a $1.7 trillion budget of Medicare and Medicaid. I mean, it's insane.
That's
6,000 jobs. I mean, hundreds of millions of lives affected.
It's a lot. It's a lot of responsibility.
Yeah, for sure. Yeah. And he got into politics. He's been in obviously he's known Trump, I guess, for a while, but 2022 he ran for Senate in Pennsylvania. And he won his Republican primary, but then lost to the Democrats. So he does have some history in politics, and now he's going to have a lot of history.
He's going to have a lot
in politics. So
well, I was really excited to read that article because the article was really about Dr. Oz being a fan and really promoting probiotics and prebiotics, which if you're not familiar with probiotics are healthy bacteria. And I know it's the big thing out there, but I also know there are a lot of people that don't know what it is, because sometimes I'll ask someone, hey, are you taking probiotics? They're like, oh yeah, I'm on Metamucil. I'm like, no, that's a fiber supplement. Probiotics are healthy bacteria. Your intestine is jam-packed full of millions, billions, trillions of bacteria and all sorts of little microorganisms that actually work together. I mean, the goal is for them to work together to help to keep you healthy. Okay, but that balance can be thrown off by stress, medications, certain foods, sugar, junk food, processed food. I mean, there's a lot of things that can throw that balance off.
Alcohol use,
smoking, exactly,
drug use, all those things.
Yeah. So so everybody is affected. Everyone's gut flora, they call it the flora. Everyone's gut flora is affected in some way, okay? Because maybe you don't drink alcohol, maybe you don't smoke, maybe, you eat really healthy. But I mean, everyone has some stress, and even stress affects that balance. So probiotics are healthy bacteria that you can take to help supplement, to help provide healthy bacteria, plant healthy bacteria into your intestine. And I mean, in my opinion, what is the downside of that?
Exactly.
I mean, I have had some of my doctor colleagues who said, well, you shouldn't be having them take it every day. You should cycle it, where they take it for a month or two, and then they're off for a month. And I'm like, but why? Do you think they're going to have a month where they have no stress, where they're not eating some processed food, where they're not taking, a Motrin or an Advil? I mean, because all of these things will throw it off. And so the probiotics are huge. It's a big trend. It's become more so of a trend over the last decade. Mm-hmm. And when I was in my training, it was like a fresh new thing. And there were mentors that were really on board with it, and there were others that were like, no, we're not going to try that. I always was on the side of, this is awesome, because I saw patients benefiting from it. Mm-hmm. So I'm very excited that Dr. Oz is promoting them.
Yeah, and the article actually also called out that he's a huge proponent of probiotic and prebiotics, mm-hmm. which is, prebiotics are just the food for probiotics. It's what probiotics need to stay alive. And that's what, when you take a probiotic, it's living bacteria, right? So it's living bugs that you're putting in your gut. And so I thought it was interesting that was called out in the article. I also thought it was interesting that after it talked about him being a proponent of it, it spent the rest of the article poo-pooing probiotics and debunking it, and all these scientific articles that say that probiotics have shown no effect, long-term effect on the body, and it's just a placebo for mm-hmm. patients. And it's crazy that people, you and I have been doing this for 15 years mm-hmm. now?
Yeah.
Okay?
Yeah.
People do really, really wonderfully on probiotics.
Yes.
And it's such a simple thing. And I mean, we don't need $1 million research study to show the positive effect that
Amen
probiotics can have on your body.
Amen to that. I mean, years of experience of using these. And I have to tell you, when we started with our wellness program and, coming and using these more holistic products, the digestive enzymes, the probiotics, all these things, I already was on the bandwagon for using probiotics. And, okay, maybe there's not a great study that proves that probiotics helps constipation. However, I can't tell you how many patients with constipation I have treated through the years with medications, prescribing them medications, who are still constipated. And ultimately, I'll be like, I'm going to try you on some probiotics, and they do wonderful.
Yeah.
They do wonderful. Now they're having regular bowel movements. They're feeling good. So years, because I've been practicing medicine over 2 decades, gastroenterology, definitely over 2 decades. So I can tell you years of experience of treating patients with all sorts of stuff. Bloating, constipation, diarrhea, people with IBS, irritable bowel syndrome, who have had a colonoscopy, a CT scan, who've had everything done, and they've been tried on different medicines and are still not doing good, where we put them on probiotics.
And literally within a month.
Yes.
all symptoms gone. Like they just feel amazing. They're having regular bowel movements. Like it's so simple.
It is.
It's so simple.
So we may not have great studies that prove, okay, however, we have patients that have proven to us over the last couple decades that these probiotics work. Okay. And, I mean, what can I say? It's
So simple.
patient after patient after patient that we've taken care
And
of.
we'll have patients say, well, do I have to stay on this for the rest of my life? Right? That with the enzymes too. And I'll tell them, look, if you're feeling good, you can try coming off of them and see how you do. Go down to 1 a day instead of 2. Like the probiotics, we normally dose them if you're having digestive issues, 2 a day, 1 in the morning, 1 at night. If you're doing good, 1 a day, right? If you're just taking it for maintenance. But I've had patients, be like, well, do I have to, and I was like, well, stop. I mean, just stop doing it. And then they'll call me. They're like, yeah, that didn't work. Like, I need to be on these things. And I'm like, okay, well, look, I would rather you be on that than on medicine for the rest of your life. Okay. That's the bottom line. Like it's either have all these symptoms and be on medicines. And yes, maybe the insurance is covering your medicine, so you can justify it. Well, I don't have the money to put toward a bottle of probiotics. My insurance pays for this constipation medicine. But the reality is the medicine is not doing the job. The medicine is just covering up. It's like a Band-Aid to the problem. It's not fixing the problem, okay? I always tell patients to think of the supplements as an investment in yourself, not an expense, okay? You have to keep your body working as it was meant to work. And sometimes we have to take things to help compensate for, like what you were saying, our lifestyle, right? Whether it's stress or what we're putting in our body that we know is not good for us, but we do it anyway, right? There's antibiotics. Like so many antibiotics in this country that people are actually getting immune to antibiotics.
Yes.
Okay.
Yeah.
But the reality is that you get sick, you go to the doctor. Sometimes they don't even know if you have an infection. They're like, here's an antibiotic, right? Antibiotics wreak havoc on the gut bacteria because it's not only killing the bad bugs, but it's also killing all your good bugs. So anytime you've been on an antibiotic, you absolutely have to be on probiotics afterward to rebuild the gut. Anybody out there, this is another one I get from people all the time that have had kind of consistent GI issues into adulthood, where we kind of go backwards and realize that as a kid, they were sick a lot. And as a kid, maybe as a baby or young toddler or, even all through teenage, they were having whatever issues and were put on antibiotics.
Right.
And during your childhood is when a huge amount, there's a period of time there where your gut bacteria is being formed, okay, where your gut is like preparing. And if you've been on antibiotics through your childhood, it throws that whole process off and makes it really hard as an adult then to have that good, healthy gut bacteria to function and help your body do what it's meant to do. So just getting on that good probiotic to help replenish, help restore, like it's so simple.
That's right.
So simple.
Very simple. And again, I just want to say, I was a little disappointed in the article, like Tina was saying, because they got caught up in the studies, the trials that have been run. But and also there was just a little bit of poo-pooing of it by a gastroenterologist that had been interviewed by the Washington Post. But we stand by probiotics as a gastroenterology practice. As a gastroenterologist, I'm a huge fan. Tina and I are both huge fans of probiotics. We have seen so many of our patients and clients, our wellness clients, get better, get well. And you can't argue with that. No. You cannot argue with that when you have someone who's been struggling with
for decades.
Constipation, bloating, whatever it may be, for decades. And now you put them on something so simple like probiotics, and they're feeling great. They're feeling better than they have.
Changed their life.
In decades.
Yep.
Okay? So think about it, ponder it. Enough
Mic
said.
drop.
That's right. If you want to connect with us, if you have any questions or any comments or anything at all, Please connect with us. You can find us on our website, drlizcruz.com. And in fact, on the homepage, there's a magenta color button that you can click and schedule a free 30-minute wellness consult. Yes, you heard right. It's free. You can do it from anywhere in the world because it's done by phone. All right. If you haven't rated us, please rate us. Please give us a 5. It'll help other people just like you to find us faster. And lastly, if you haven't subscribed to our podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.